Welcome to State of Wellbeing, a podcast from South Dakota State University. The State of Wellbeing is a holistic well-being podcast with the goal of supporting the campus community as we strive to be a growing, high-performing, and healthy university. Welcome to State of Wellbeing podcast. This is a brief disclaimer that this episode is not meant to diagnose or treat any sleep issues, and as always, please see your health provider with any questions. Welcome back to another episode of State of Wellbeing podcast. I'm Caitlin Walters, the Wellbeing Specialist, and joining me today is
April Schneider, a nurse practitioner from the SDSU Student Health Clinic.
April, thank you so much for being here. I know this is something you and I have talked about a lot, kind of just in between in our personal time. We're both kind of sleep nerds, I would say. So today we're talking about sleep. And we know this is a huge issue, not just for college students, but just for people in general. People are not getting enough sleep. And so we want to really talk through some of the ways we might be able to improve our sleep. What does good sleep look like? Maybe what are some signs of bad sleep? So thank you so much for being here. I'm really excited to talk about this.
Thank you. Me too.
So we'll kind of jump right in. What does good sleep look like?
So good sleep is going to look like feeling well rested, having enough energy to get through the rest of the day. When you do sleep, you're not having a restless sleep. So just being more present, more energetic.
And I think what's really important too with good sleep is it's going to look different for everyone. So what I feel really great and refreshed after, you might feel like that's not enough. But generally, I have told people it's between 7 to 9 hours of sleep. Would you agree with that?
Yes, absolutely.
I think especially if you're more highly active, so if you're doing a lot of exercise or if you have really busy days, you're going to want to be a little bit closer to that 9 hours of sleep. But 7 to 9 is generally the recommendation across the board.
Yes, especially for young adults, and athletes can even go up to 10 hours.
And I'm sure a lot of young adults on campus were probably like, I would rather get 10 or more hours of sleep. So I guess on the other side of that, we feel well rested, we wake up, we feel good, we've gotten at least 7 to 9 hours of sleep. A couple other things with good sleep, I would say, would be, you're able to fall asleep fairly quickly. I don't know what do you kind of use as like the gauge for that?
Yeah, we should fall asleep within about 10 minutes of just getting into bed, laying there. We should drift off into that first phase of sleep right then.
Do you have any other measures of good sleep?
Yes, falling asleep quickly when you lay down, and then also staying asleep or having minimal night wakings. So your goal is to go to sleep, stay asleep until it's time to wake up, hopefully getting that 8 to 7, 8, 9, 10 hours of sleep.
So we've talked a little bit about good sleep. I think most people know what some signs of bad sleep are, but do you have any indicators that you're not really getting a good restful sleep? What does that look like? And also, what does a bad night's sleep do to you?
It's different for every person. It can affect so many things, and that people have no idea that some of their symptoms are actually related to their sleep. So we can look at weakened immune system. We can look at decreased physical or mental performance in school. We look at impaired judgment, troubles concentrating, which is necessary for any of our students here. Memory issues. So we are not having that ability to maintain what we learned in school because our sleep isn't allowing us that time to kind of store that memory, that thing that we just learned today. We also see mood issues, being more short. I mean, if I don't get enough sleep, I'm a little short with my family. We also see decreased sex drive. We see increased risk for other diseases like heart disease, diabetes, high blood pressure. So very important, but so many different ways that it expresses.
And I know you and I have presented to some athletic teams on campus. Do you want to talk a little bit about sleep and the interaction with athletic performance or just physical performance?
Yes, absolutely. So with athletes, we'll see a decrease in their physical performance. So, it may be that they stayed up late studying and then they have a game the next day and it can be expressed in the game. And so it will be something where that sleep is vitally important. We also see that their pain expression is sometimes higher if they have less sleep. So might be where they twisted an ankle. their pain tolerance is going to be lower. They're going to feel more pain because they're not getting that rest that they need. And then we look at longer recovery times. The body doesn't have the ability to convert their glycogen stores. And so in that term, too, it can't use the energy. And so sleep is vital for those athletes that are also students.
And I like to think, too, because, I would not consider myself an athlete, but I do like to run. I like to, use the gym and work out. And I like to link it to that, too, that even if you're not an athlete, you're not performing at like a really high level, it's going to impact your ability to, I hate to say like make those gains in the gym, but it is going to impact your ability, your gym experience, your running experience, whatever that physical activity that you like to do. The lack of sleep is really going to impact your recovery time, your performance in whatever physical activity you like to do when you're out. So I think it's vital for athletes. It's also really important for people who like to just do some type of activity on their own time, kind of like whatever that may look like, right?
It can also impact the coordination. So if somebody's looking to just do like free weights or working out on their own, their increased risk for injury is because they can't coordinate things. The balance can be off too. And so, yes, absolutely. Anybody who's working out on their own can increase those risks with poor sleep.
I think that's really helpful. So we talked a little bit about memory and the impact of, poor sleep on memory. Can you walk us through a little bit more of like what sleep, the cycles of sleep, what REM sleep is? I think, we kind of hear it a lot just out and about, but what does all of that mean? What does a sleep cycle look like?
So a sleep cycle is going to have 4 stages. We'll have that first stage where we start to fall asleep. It's really relatively quick. The second stage is where things start to get relaxed. We're not easily woken. We end up kind of gauging down into our third cycle or phase of sleep. And at that point, we're deep sleeping. We're relaxing those muscles more. And then we get into REM sleep. And the REM sleep is really where we get that regeneration of our memories and our physical body. And so if we aren't getting into the REM phase, or we're not getting enough time in the REM phase, then we end up with subsequent responses from that.
Yeah. And I think that's where, there's some research out there. It was, I think the headline was, that staying up for an all-nighter to cram and study for your exam the next morning is actually just as bad for you as 6 months of unhealthy eating. So one, if you're cramming all night, you're not getting that REM sleep, you're not actually maintaining any of those memories that you've made, any of the memorization, any of the work that you've done during the day. But then also it's, like you said, it's bad for your physical health. And so just thinking, it actually might be better to go to sleep, get a full, as much sleep as you can, and maybe wake up a little early and continue studying, but you really have to hit that REM sleep to be able to form those memories that you're actually trying to make for your studying that you're doing.
Absolutely. I will tell students that it is far better to stop studying. The day before the exam should be all about preparing your body for that sleep and for the exam the next day, not for the brain anymore. So literally getting them a good meal, getting them to bed, sleeping as best that they can. That all-nighter doesn't gain any more knowledge. Research shows that. We don't learn anything new in that period. And so you lose your sleep. You didn't learn anything new. And then you're suffering the next day. Your performance is paying for it. So we have you hold off on that. Prepare for that exam the day before. Get that rest, that meal, that sleep, and then wake up refreshed and just have that self-confidence that you can go into your exam and just say, I can do this.
I think that's really good advice, and I wish that someone had given me that advice when I was in school because, yeah, it is that whole, it's the whole body. It's that, that well-being piece of now I'm going to take care of the rest of me so that I go into this test feeling good, feeling refreshed. And I think, I think people don't love to hear it, but it comes down to really good time management and making sure you're planning out your studying, making sure you're planning out your work beforehand so that you do have that day to really stop and take care of yourself and get that good sleep.
Absolutely.
So we've talked a little bit about some signs of poor sleep. What are some of the reasons that people don't get good sleep?
There can be so many different reasons. At the top of my mind, medical conditions, also mental health conditions, pain, medications, caffeine, nicotine. There are a lot of different things that can cause a disruption in your sleep, and sometimes it's kind of digging through the weeds to figure out what it actually is and get to the bottom of it.
I drive past one of the coffee shops in town, and when I drive past, any time in the late afternoon and I see folks grabbing their coffee, I'm always like, but your sleep tonight. What is the cutoff time for caffeine?
It depends on the person, but I would say after 4 p.m., it would just be better go caffeine free.
And I think that might be part of it too, is that people may say like, well, I can drink coffee late. It doesn't really impact me. I'm still able to fall asleep. And that may be true, but I know for me, and this is again, like personal, it's going to be different for every person. But when I do drink coffee or caffeine too late in the day, I may be able to fall asleep, but it is not very restful. And I feel like I'm kind of missing on that, like the deeper cycles of sleep, because I'm just kind of stuck in that light, like restless sleep where I'm like in and out of wake up and falling back asleep. And so I think it is, stopping to think, I might be able to fall asleep, but am I getting that like quality deep sleep?
Absolutely. Some people will even think that having like a nightcap or a little bit of alcohol at the end of the day helps for them to relax and go to sleep. And then we fall into that same problem where people are falling asleep, but their sleep is definitely not a restful sleep. So
yeah, it's going to impact that REM sleep later on.
Yep.
I think there are a couple other, I would say more like activating things that you may do before bed. I think obviously the big one is screen time, right? So if we are scrolling through our phones before we try to fall asleep, I do it. I think a lot of people do it. It's like, I'll just scroll through my feed real quick and just see what's going on. But that's a really like energizing thing. It's waking up your brain, and it's going to impact your sleep later on as well. What is the cutoff for screen time?
So I typically say 1 to 2 hours before bed. And you're looking at the screen. The screen has that blue light, which actually wakes up the brain and says, hey, let's go do stuff. Let's learn new things. And so it's activating it, keeping it running. And instead of having that nice slow down to the end of the day, your brain is still running. And so I actually had some research that came out yesterday. And so it came out showing that it's not actually the amount of time before bed that we remove the screens, but it's actually if you go to bed and you take your screen with you. So it's where you're looking at your screen. So if you're out in the living room, sitting in the chair an hour before bed, their theory is that is okay, as long as when you go to bed, you put the screens away. So that bedroom, again, is going to be like a place for just sleep. If you take the phone into bed with you and then you start scrolling, that's where they start to see the problems. And it's newer data, so we're still looking at it. But I thought that was pretty fascinating.
That makes a lot of sense. And that kind of goes back to that piece. When we talk about this on campus, we often talk about making your room like that sanctuary, where your room is your sleep sanctuary. So really trying not to use your space, especially your bed, as a multi-purpose place. You don't want to be doing any studying in your bed. You don't want to be doing any like late night snacking in your bed. The bed is meant for sleep. And it tells your brain, okay, I'm getting into bed, I'm going to go to sleep. Now, if you study in your bed, then your brain, when you go to get in your bed, it's like, okay, I think I'm going to be studying. I could be sleeping. I don't really know. I'm a little confused. But having that like consistent, like I do this, I brush my teeth, I wash my face, and then I'm getting in bed and it's time for sleep. But if you start confusing that, then it's going to really have some consequences on how quickly you fall asleep and how well you sleep.
Absolutely. Similar to the kitchen. When we go to the kitchen, we're triggered to think, okay, I'm hungry. What am I going to eat? So the bed should be the same way. So the bed should trigger us to say, it's time to go to bed. We don't sleep in the kitchen. We shouldn't eat in the bed.
Exactly. Any other reasons why we might not be getting asleep?
Medications can sometimes do that, and I mentioned that a little bit. So sometimes we'll use a medication that helps our mood, and that can sometimes impact our sleep cycles or the way that we get through our sleep cycles. It might minimize the REM sleep or that phase or stage 3 sleep. So it's worth talking with your provider if you're on a medication that's interrupting the sleep or causing you to not feel rested, versus maybe finding another medical problem underlying sleep apnea. We think of pain disorders, diabetes, different types of like autism. They can all cause interruptions in your normal circadian rhythm.
And I think it's really good that if you have questions on any of these, we do have folks on campus that you can come talk to, right? So if you are dealing with anxiety and you're having a hard time falling asleep because your brain is just kind of like failing to shut down, it's spiraling, you're thinking about things that are keeping you awake, come in and talk to one of our counselors. On the other side, if you're feeling like maybe it's something more medical, physical, come in and talk to one of our CNPs at the health clinic.
Absolutely. We are actually housed in the same office. And so we have one hallway that's healthcare, one hallway that's counseling. We work very closely together because a lot of mental health and physical health are combined. And so for screenings, if anybody's concerned or a friend is concerned about a friend, you can have them walk in for a screening with our counseling team. It's free and it's offered from 8:30 in the morning until 11, and then again from 12:30 until 3, Monday through Friday. There's no appointment needed. You just walk in. What happens is you tell them they're there for a screening. They'll give you a piece of paper and have you write your concern down, and then you meet with a counselor, and it's one-on-one. You determine what exactly your needs are, and then they give you a plethora of resources that can help you. Sometimes it's just working through the issue that you came in with, and then that results in better sleep. Sometimes it's where, we have a pain issue, and then I'd be happy to see them. My partner, Janae, would be happy to see them. We kind of look through things like, is there an electrolyte imbalance? Is your thyroid malfunctioning? Why is it that we're having this pain? Was it an old injury? We need physical therapy it back to normal. And so a lot of different reasons. I always say it's like an investigator. We get to figure it out. So we love working with our patients and figuring that out.
That's wonderful. I think we talked a little bit about medications, and I wanted to ask because I think it's something that people often just kind of take without talking to a medical provider. But melatonin is kind of advertised as one of these, like it's going to improve your, like it's going to help you with sleep. And it's a supplement that, I think it's been marketed as this like wonderful sleep aid. Do you want to talk a little bit about that and just like what people should think about or consider before they start taking anything that's labeled as a sleep aid?
Absolutely. So melatonin, I see students, patients on that all the time. It's something that I don't really recommend. If we were to use it short term, say there was a stressful situation in your life and you needed just a little bit of help for a couple of nights, it'd be okay. It is still not a good sleep aid. So what it does is it will kind of put you to sleep relatively quickly, but you'll wake up in the middle of the night and you'll be ready to go. So it's not where you're staying asleep the whole night. So it really doesn't benefit the patient for very long. I also tell patients that if you do take it, the maximum dosage would be 10 milligrams in a night. Most people never need that high of a dose. If we were to take it, we take it at least 30 to 60 minutes before we climb into that bed so that your brain doesn't override the medicine. And so, again, I don't recommend it. We have seen where some patients will try to use doses really high, like way above 10 milligrams. And what happens then is it stops your body from actually making its own melatonin. And so we're losing the game completely then. So we think of things like Z-Quil, which is really a Benadryl. That leaves people with that hangover-y, foggy feeling for a day or so afterwards. It is really not productive sleep. So sedation is a lot different than being tired and actually getting good quality sleep.
Yeah, I think it's really important that before folks start just kind of taking these sleep aids, even if they are available over the counter, to talk to a medical provider and make sure that that's the right option for you, because I think it's easy to think that you're doing something that's actually beneficial and then finding out, well, it's actually keeping me from getting that deeper, higher quality sleep.
Absolutely.
So we've talked a lot about, what can go wrong, what might be causing us issues with sleep. How do you like to recommend that we improve sleep?
It would almost be like sleep training. I mean, when you're looking at going into it, it's not going to be just, I'm going to do these things and I'm going to sleep really good tonight. It's going to be that where you try again over and over. But we start with the sanctuary, like you talked about, where we have a nice, cool, dark, quiet room that we're sleeping in, comfy bed. If we need to, sometimes we'll use some like eye coverage or some earplugs.
Yes, I had a roommate in college who was always on her computer until about 5 o'clock in the morning. It was an all-night thing, and I really could have used those sleep masks because I would roll over and the room's just kind of glowing because she's, watching YouTube or something. But if you're in an area where you maybe can't control how dark it is, and we've talked to some of the athletic teams about this, of like if you're traveling, if you're in a hotel that doesn't have great curtains, maybe a sleep mask might be a good option.
Absolutely. Absolutely. And then we look at like the schedule, like getting that preparation for bed, like getting your mind to know that you're slowing things down and that it's time to rest. So turning down lights as your evening progresses, wrapping up the things of the day. Maybe it's washing your face or taking a shower and then crawling into the nice crisp sheets, something like that. And that's your routine, where we keep practicing that routine or that training over and over. And then the body starts to identify that this is my trigger to go to sleep. So that becomes easier and easier. Now, sometimes we don't fall asleep when we lay in bed, and there are different techniques we can use to kind of help our brain turn down. Sometimes it's a sound machine. Sometimes it's like a white noise if you wanted to. Sometimes it's a bedtime story or reading an actual book, like a paper book. Sometimes it's going to be where you do a progressive relaxation of your body, or maybe some meditation that slows that brain down and just gets you into that mode ready for bed.
Yeah, I really like the square breathing technique, where you breathe in for 4 counts, you hold it for 4 counts, breathe out for 4 counts, and hold it out for 4 counts, and you can kind of trace a square. But for me, that one has always helped just because it's very simple, and it kind of just like feels like it's slowing everything down a little bit.
Absolutely. I also think of one that I call melting into the mattress, where I have you lay in bed and you take a breath in, and as your breath goes out, you imagine that your body is sinking into the mattress. And so each nice slow breath, and then you let it out and you sink a little bit further into the mattress. So that kind of just gives you that calming, warm, comfy feeling.
Any other ways to improve sleep?
Don't do some vigorous exercise ahead of bed. So if you're an avid exerciser, try to do it earlier in the day, because just like screens, vigorous exercise is actually going to wake up your body. So I would avoid that. I like to do, you had talked previously when we've met before about goal setting. Like, how do we achieve this? What are some goals that the person would want to set up to be kind of aiming towards that good night of sleep?
Yeah, and I think I like to talk about that. And I also like to mention, when you're training for a race, you don't just run like, say you're training for a half marathon. You're not just running a half marathon, you're slowly building up to it. And I think a lot of the times when you think about, I'm going to try and improve my sleep, it's not, I'm going to do all of these things, all of the recommendations the first night, because you'll never achieve that goal. You're going to fail to do something. You might be able to do it for 1 or 2 nights, but eventually you're going to be like, oh, I'm scrolling on my phone in bed. But really, it's identifying simple ways that you can start out and then progressing to more, what I would say like harder goals to achieve, right? And so maybe in my first week, I'm going to say, this entire week, I am going to put my phone down in the living room. I'm not going to look at it an hour before bed, and I'm going to go straight to bed. Maybe it's I'm going to spend 30 minutes in bed reading a real paper book, no screens, no Kindles or anything like that. And I'm going to actually read that in bed with some dimmed lights. But setting different types of goals. And then when you achieve that, it's okay, I'm going to maintain this habit, but I'm going to add to it. So now I'm going to, do a gentle yoga exercise before bed. Then I'm going to read my book, and really setting up that routine and adding on more things to help keep you relaxed and calm.
Absolutely. Now, sometimes people will try to catch up on their sleep, and they will take a nap the next day. Like, you had a rough night, so the next day you're taking a nap. There are good things that come out of a nap, but it can go really wrong. And so our recommendation is to do your napping in the early afternoon, so nothing too late in the day, otherwise you'll mess with your circadian rhythm. But try to keep it 20 to 30 minutes. So just a short siesta and then back to it.
Yeah, I think there's it's kind of like you're either a person who takes naps or you don't take naps.
I wish I was a napper.
Now, I think all of this is really great. I could listen to this as someone who doesn't have kids. I can say I'm going to go home and I'm going to set these goals and I'm going to go to bed and I'm going to wake up and, I have all these plans, right? What about for people who have kids or who have things going on that kind of keep them from being able to really get that like solid night. So you can't control that your child's going to come in and wake you up in the middle of the night.
I do think that parenting is hard. It depends on the age of your kiddos. So when they're young, you're kind of in survival mode. You have to meet their needs in the middle of the night. Babies cry, babies need to be fed, changed, those kind of things. So it's maybe something where you can alternate with your partner. And if you have a partner, you just switch back and forth. Or you try to help, like have a family member help out, and so you can make a good night of sleep every once in a while. As the children get older, it's good to teach them these methods. Like their bedtime routine, teaching that young and early is just as beneficial to them as an adult. And so train the whole family. Like do it as a group effort.
Well, and I think I heard you once say that, you saw it as something that was important to model to your kids, that, I actually really prioritize my sleep, and I'm going to make sure that I model that getting good sleep is very important to me. And so I'm going to have some boundaries around that. And this is how I get my good sleep, and showing them that, this is something that's important that they should care about too. I thought that was really great. I think one other thing, as we think back to a couple just ways to improve that sleep, we haven't touched on, so I want to add it, is having that consistency as much as possible. And so let's say, during the week, I go to bed at 10 p.m. and I wake up at 7 a.m., right? I don't know how long that is, but let's say I do that during the week. I think it is really important that you continue that. And they actually recommend that if you're going to try to sleep in on the weekends, that you actually don't sleep in much more than 30 extra minutes, to really try to keep that sleep schedule consistent throughout the week. And so don't think like, well, I can shorten my sleep Monday through Friday when I have classes and I'm going to stay up late and study, and then I'll catch up on the weekends, because that just makes it harder on Monday morning when you have to wake up back at 6 a.m. again. And so really making sure like I set my schedule and I'm going to try to stick to that schedule.
Absolutely. It's the consistency that matters. And speaking of that consistency, it's that early morning light exposure that helps kind of set that wake up. So if you sleep past that part on a Saturday morning and you're in the middle of the day when you wake up, you have messed up your rhythm then. So it's best to continue to wake up, get that early morning light in your eyes. Winter will be a challenge for us, so it's turning on the lights in our house at that point. But in the summer and the spring, we can get that bright light into our eyes. That is also helping to wake us.
Yeah, I think, like you said, like exercising during the day if possible. I'm never going to tell someone not to work out, right? Exercise is we know that physical activity is really important for us. If you're going to exercise late at night, trying to make sure that I might not be doing like, maybe I like taper off or I slow down a little bit. I'm bouncing around a little bit, but also just like spending a little bit of time outside. So you said the morning light exposure, even there is some conversation out there that evening light exposure can help kind of prep your body, like the sun's going down and now I'm going to also start to settle down, right? And then that early morning light exposure can help wake you up. And so it's kind of that balance, and maybe it's just I'm going to take a walk around campus, early morning, or in the evening I'm going to try to walk my neighborhood and get a little bit of that like later sunlight in my eyes too.
Absolutely. Or if, like you said, if you have to exercise, that's your only time of the day, is to exercise at the end of the day, then end it with a meditation or a yoga. Either one of those kind of helps to get that body to ramp down.
Awesome. So are there any tools out there that you like to recommend? I know that we talked a little bit about like avoiding screen time, but I think there are some apps that are helpful in just kind of navigating all of this. Anything that you like to recommend?
It can be any app, actually. If you want to track your sleep, you can do it on paper. You can do it on an app. If you have a wearable, you can wear your watch to bed and see what your sleep cycles look like. Not everybody has that, and paper does just as good of a job. Like, how did you feel rested in the middle, after your night? Did you wake in the middle of the night? How long did it take for you to fall asleep? Those kind of things, just to start getting an idea of where you're falling. And then that can help you identify issues and then address them.
I actually, interestingly enough, I listened to someone who was doing some research on sleep tracking watches, and they were saying that sometimes when you look at your watch and you see, oh, it says that I didn't get enough REM sleep, then you start to like, oh no, like you feel bad about it. And then actually it can almost make you, like some of those sleep trackers can make you feel worse about the sleep that you're getting. And so I always like to tell people, like, take it with a grain of salt, because I know that my watch is a little older, but when I sleep and if I keep my watch on, I check it the next day and it's like, oh, you got this much sleep. And it's like, I know I was wide awake, when it says that I was sleeping. And so taking it a little bit with a grain of salt, but, thinking, like looking back and actually, considering how was my sleep, maybe keeping that journal, like you mentioned, really tracking it down, because that gives you a starting point. Then, I'm getting this much sleep at night. I would rate it, 5 out of 10 stars, right? Really trying to think very critically about the sleep that you're getting and then set some goals from there that are applicable to you.
Absolutely. I was wearing my Fitbit to bed, looking at it every time, and I would be like, man, I thought I slept good last night, and my watch says I did not sleep good. And then I kept thinking, what am I doing? I got to reset myself. And over the summer, I just stopped wearing my watch. Still slept good.
Yeah, I think a lot of it, again, it's so personal, and it goes off of, how you're feeling. And if you're feeling good on the amount of sleep that you're getting, then, maybe working on ways to improve it slightly, but just trying to keep good track of what your sleep is and how you feel based off of it, so that you can kind of evaluate what you need to improve. Anything else that you wanted to mention?
I had read a study about grad students, and they compared grad students to undergraduate students, and that their sleep issues were definitely multiplied compared to undergraduate students. I think they have an additional life issues going on, working, we're doing research or residencies, things like that. So graduate students definitely have a harder hill to climb compared to the average duck.
Well, and, I think back, I was a graduate student and I was married. I had a lot of our graduate students might even have families. And so having to not only balance that research, the work, school, and then also family too, there's some research out there on burnout and graduate students and sleep, and how sleep can kind of help, counterbalance some of those negative effects of all of that pressure and stress. Having that extra sleep may actually help reduce some of the burnout that comes with these, high demand programs.
Absolutely.
Anything else?
That's all I have.
Well, April, thank you so much for talking with me today. I think if anybody's listening and you say, I want to learn a little bit more about that, I would definitely recommend coming by the health clinic. For students, coming by the health clinic and checking in and asking, very specific questions about themselves. You're there, you're happy to help. Janae's there, they're happy to help. And also our counseling side is also available, and they can also talk through some different sleep things as well.
Yes, we're really easy to find. We're right inside the Miller Wellness Center. And the health and counseling services are right there.
Well, thank you so much.
Thank you.
So our processing questions for this episode are, what are some of the consequences of getting a poor night's sleep? Also, what is the importance of REM sleep in your sleep pattern? What is the importance of REM sleep? And finally, what is your self-assessment of your sleep? Are you getting enough sleep? What is the quality of that sleep? Rate yourself on a scale from 1 to 10. Thank you for listening to this episode of State of Wellbeing, a podcast from South Dakota State University. This podcast is brought to you by the Mental Wellbeing Team and SD State Health.